We'll return to federal politics now, and one of the politicians to benefit from Julia Gillard's ministerial reshuffle is the former Human Services Minister, Tanya Plibersek.
She's just been promoted to take over the health portfolio, and she joins us now from Sydney. Tanya Plibersek, good morning.
Good morning.
Now, health is, as you know, a very important and equally a politically sensitive portfolio. What do you see as your key priorities as you prepare to take up the job?
Well, it's a very important portfolio because it touches the lives of every Australian, and I'm really excited by that challenge. I think we've got a very strong set of health policies, and I'll be continuing on with those. We need to make sure that people are able to see a doctor when they need to, where they need to. So that means we've got workforce issues. We need to make sure we've got enough doctors, enough GPs, enough nurses trained. It also means that we need to keep rolling out our GP super clinics and our Medicare locals. We've got some really important changes that we've made in the area of cancer, for example. The work that Nicola's doing with tobacco, the tobacco litigation will go with her, but the other policies to reduce smoking, of course, stay in the health portfolio, and the rollout of the regional cancer centres that will mean 8 million Australians will have better access to more comprehensive cancer treatment closer to home. It's another huge challenge, making sure that they're rolling out across the country and people are able to use them as soon as possible.
There are a couple of... Yeah, go on, Minister.
Yes, go on.
Yeah, I was going to say that there are a couple of big issues, including those in your inbox, one of which is the means testing of the private health insurance rebate. Your predecessor, Nicola Roxon, has tried unsuccessfully on a few occasions to shepherd that legislation through the House of Reps. How confident are you, as the new Minister, of succeeding?
Well, I'm not the new minister yet, I'm sworn in tomorrow, but I am very hopeful that we can do something about the fastest growing area of health expenditure, which is the subsidy for private health insurance. And it's going to be very important, obviously, to work with the crossbenchers and the Greens on this and other issues, but it would be terrific as well if we could get the support of the Liberal parties and national parties for these measures that actually are designed to benefit all Australians. I'll be working closely with the states and territories as well, because health is something that we need to approach as cooperatively as we can.
The subject of a lot of debate recently is that of dental care. There have been renewed calls for a universal dental healthcare scheme model along the lines of Medicare. The Greens are after something like that, care of their post-election agreement with the Prime Minister last year. Do you support the idea, the concept of a universal dental healthcare system?
Well, I certainly think that we need to change the way that we're delivering dental services, particularly to the poorest Australians. At the moment, we've got some good schemes like the teen dental health checks, where almost 1.5 million teenagers have had free checkups. But the chronic disease dental scheme that we inherited from the previous government is not the best designed scheme in the world. It doesn't. You can be a millionaire and get $4,250 worth of treatment for your teeth, or you can be very poor and, because you don't have a chronic health condition, not receive that treatment. So we need a more sensible way of making sure that all Australians, but particularly the poorest Australians, are able to look after their teeth properly.
Would you embrace a universal dental scheme?
I'm not going to. I'm, less than 24 hours since this announcement was made. I'm not going to start making up policy on the spot. I need to talk to the states and territories. I need to talk to the stakeholders in this area. Of course, I need to talk to my department. I need to be sworn in before I can start making pronouncements as Health Minister. But dental care is a very important area of health policy, and I'll be looking forward to working with people to come up with a sensible solution.
Looking broadly at what the Prime Minister announced yesterday, as a member of Labor's left faction, are you disappointed at the dumping of your factional colleague Kim Carr from the Cabinet? Do you believe that was warranted?
I'm not going to make any comments about other people being elevated or demoted. I think this is a terrific opportunity for me. I'm very, very grateful to the Prime Minister for the challenge that she set me and the faith that she's shown. I'm really looking forward to making sure that all Australians get a better quality of health care, that they get medical treatment when they need it, where they need it, and I think that's challenge enough for me.
OK, well, finally, you're one of now 5 women in the Gillard cabinet. The Prime Minister was labelling this a red letter day for women yesterday. What do you see as the significance of this?
Look, I think it's really important that our cabinet, our ministry, our parliament and business and the not-for-profit sector as well reflect the true makeup of Australian society, and that means men and women more equally represented. It means a range of ages, it means a range of backgrounds, it means diverse life experience. I think we make better decisions when you see the whole range of the experience that Australians have represented. And I think that's true in government. I think it's also true in business. The businesses that have more diverse board makeups, for example, generally do better, are more profitable businesses. And I think that's because we each bring our experience, and then we make a decision together that reflects the broad range of Australian experience.
OK, Tanya Plibersek, the Nellie Health Minister, thank you very much for your time this morning.
Thank you so much.